On December 29, 1970, the Occupational Safety and Health Act was signed into law, establishing a new federal agency to set and enforce workplace safety and health protections for American workers. On April 28, 1971, OSHA first opened its doors. And in its first half-century, the agency has helped transform America's workplaces in ways that have significantly reduced workplace fatalities, injuries, and illnesses. In its initial years, OSHA issued the first federal workplace health and safety standards.
The agency was the instrument of a revolutionary law. I always looked upon it as ensuring Americans of a new right in the Bill of Rights, the right to a safe and healthful workplace.
The agency's first standard provided worker protections from asbestos. Health standards for lead, carcinogens, and cotton dust, as well as construction safety standards, followed in that first decade.
One of the most important, I'd say memorable events was having the cotton dust standard ready to go out.
These initial standards have significantly reduced worker exposures to these hazards and help to prevent workers from dying or suffering chronic disease or serious injury. In its second decade, OSHA issued standards giving workers the right to know which chemicals they may be exposed to and requiring employers to provide workers and their doctors with medical and exposure records. The agency also established its first cooperative program, the Voluntary Protection Program, or VPP. OSHA's cooperative programs provide businesses, labor groups, and other organizations the opportunity to work with the agency to improve workplace health and safety. The 1980s also brought important worker protections for combustible grain dust, trenching, noise, and hazardous energy. The 1990s brought a chemical process safety management standard to protect workers from the risks of chemical fires and explosions. New and stronger standards addressed falls, bloodborne pathogens, and toxic substances.
When you go into a hospital or any sort of healthcare facility now, there's a sharps container on the wall. Everybody is wearing gloves. There's special equipment to make sure people aren't stuck with needles. That's all because of the standards that OSHA put out during the HIV/AIDS epidemic. Most people in hospitals have no idea that those precautions are in place because OSHA made them. OSHA put them into place.
Workers in confined spaces, longshoring and marine terminals, and laboratories also gained stronger protections. For the first time, safety and health training became widely available at the first OSHA education centers, and the new Strategic Partnership Program expanded collaboration with employers. Shortly after the dawn of the new century, the nation was forever changed by the terrorist attacks on September 11, 2001.
I came into Lower Manhattan and everything was dark from Canal Street all the way down. Our folks were already there working issues and trying to understand what the risks are.
The 9/11 response and recovery efforts shaped how OSHA and the federal government have responded to subsequent disasters or events, such as Hurricanes Katrina and Sandy and the Deepwater Horizon oil spill. The 2000s also saw new standards to protect construction workers in steel erection and prevent exposure to hexavalent chromium. In its fifth decade, OSHA issued standards for silica dust, beryllium, cranes, confined spaces, and the classification and labeling of work-related chemicals. The Severe Violator Enforcement Program was established to place an inspection emphasis on employers with a history of safety and health violations. The agency also launched several initiatives to address serious workplace issues, including fall prevention,